Hi, what's the situation today, February 18th, regarding coronavirus? Well, a few numbers so that we can judge a little bit and have an idea of what to expect. Now we've had a month and a half of epidemic, so we know a lot more than we knew. And as the epidemic goes on, each day will give us more information, so it's important to keep updated. First, the amount of cases. We're now at 73,336 cases, with 98.7% concentrated in China. So it's mainly a Chinese infection, Chinese disease. Of course, we have almost 1,000 cases outside of China, and we now know mortality rates outside of China. But what we have in China will give us a clear idea of what might happen in the rest of the world. So let's try to understand Chinese numbers. 82% of the cases in China are concentrated in Hubei, where the epidemic started. 18% in the rest of China. Mortality rates for Hubei are still around 3%, which is quite high. One patient out of 30. One death out of 30 patients. Now for the rest of China, it's a lot less. It's 0.60, 0.6. So it's 5 times less. What do we have in the world? Almost 1,000 cases with a mortality, 4 people died. So that gives us a mortality of 1 death for every 200 patients. More or less what we see in China outside the province of Hubei. So I think that we're getting a better picture of the mortality rate, which is probably around 1 death for every 200 cases. This is what we should see in the next few days, the next months. Of course, as time goes by, we will have more knowledge, more experience. In Hubei, probably what's happening is that hospitals are so overcrowded that they cannot deal with difficult and complicated cases, so the mortality is a lot higher. Another thing that is very important is what's happening with this cruise ship that is boarded in Japan. We now have there 454 cases. So that gives us an idea of how it spreads. Well, if it started with 1 case, that gives us a clue of how fast this can disseminate. It seems to be rather easy because in 10 days since it started, with 1 case, we have 454 new cases. Of course, we still need to know how these people are going and how they feel with the infection. Because eventually, with almost 500 cases, we will have an estimate of the deaths and we will know in a controlled case what is going on. What is very important to notice is that people who have chronic lung disease, high blood pressure, diabetes are under a lot of more pressure when they're sick. So one of the main things is that if you have a chronic condition and you get sick with any respiratory virus, go see the doctor. That's very important because we can get treatment and we can follow up to see if things are getting worse or not. Don't wait until it's too late. The second thing is that the mortality rate we have now, more or less 0.5%, is more or less 4 times, 5 times more than what we see for influenza. So that means that coronavirus is a little more serious. We have vaccines and we have treatments for influenza. So that changes the figure. And probably when we will have these tools for coronavirus, the death rate will go down. The second problem we have with statistics for coronavirus is that in the Western world outside of China, we have enough tests to be sure if people are having the infection or not. But probably in Hubei, they are so overcrowded and the health system is so unable to deal with all the cases that we don't really know if they only have the cases we think they have. So let's wait and see what happens in the world. Fortunately, in the world, I checked the number for the last 4 days. And what we saw is as follows: 595 on the 14th, and 685 on the 15th, 780 on the 16th, 896 on the 17th, and 898 today. So that means that we had 90 patients more from the 14th to the 15th, then 95 patients more the second day, 160 patients more from the 16th to the 17th, and only 2 new cases from yesterday to today. So it's not an enormous amount of new cases. Statistically, it's more or less the same amount of cases that is growing up every day, around 100. That's something that means that we're able to control the epidemic, and that's a good thing. So basically, the idea now is to understand that coronavirus is probably something that will get chronic. We will get a vaccine, we will get treatment later, and probably we will have the same situation in the future we have now for influenza. When it started, we didn't have anything. Now we have treatments and vaccinations. We will probably have this for corona. So basically the goal now is to keep patients that are sick away from persons that are healthy. And second, try to understand the speed with which it goes from one patient to the other. What happens in this cruise ship will give us a very good idea. 10 days ago we had 1 patient, now we have almost 500. So I think it spreads quite fast when you're in a closed environment. That gives us a very good idea of what can happen when we gather around in crowds for schools, universities, or events. And that gives us an idea of what we should do to stop the contamination of everybody. Thank you. Have a nice day.